red meat is going to cause type 2 diabetes.
Right.
You need to avoid it.
Right. Yeah. So then let's shift to that then. Perfect timing. What I would hope that the person who just wants to drill it down to the simplest idea, at the very simplest level, the whole idea breaks down. Because if you look at the consumption of red meat within the United States over the past 60 years, it has gone, well, it went up a little bit in the 70s, and then it has had a steady drop year over year from the time of around 1970 till now. We eat less red meat now than it appears we probably have ever eaten, at least in recorded history of the United States of consumption patterns, and I suspect even further back. As a percent of calories, we eat less red meat. It has been going down over the past 50 years. And look at what has happened to the trends of virtually every chronic disease, diabetes included. It doesn't even pass the simplest level of correlational, just eyeball test. You look at one curve of saturated fat, or red meat, I'll say, because I'll get to saturated fat in a second. I mean, by every metric of USDA and the United States monitoring consumption patterns, red meat is going down. And diabetes keeps going up. It just doesn't work. Even at the most superficial level, the whole idea breaks down. Now, and so, and if you'll allow me, Ken, again, I don't mean to sound like I'm someone's preacher, but it's amazing for me to even see how, Ken, can I mention a scripture in the New Testament just
Absolutely.
for fun?
Yeah, absolutely.
Just for fun. Anyone who believes in the Bible, just go to 1 Timothy chapter 4 and read what the Apostle Paul told Timothy, this young disciple, when he was prophesying of the latter days, our days, if you will, looking into the future, if you believe Paul had any kind of prophetic gift. And one of the things he says would be a sign of the times, would be that people would command others to abstain from eating meat. And these would be people who had been deceived, in his words, by the spirits of devils. And I don't want to sound silly. I'm very practical, but also very religious. But it's amazing to me that even in the New Testament, 2,000 years ago, there were people who could see the trend of people who I would say maybe kind of are losing their minds. And they would try to command you to not eat meat. And Ken, you look, every celebrity, every sports star, every government entity and corporate entity, what is the one thing they all agree on is that meat is bad and we shouldn't eat it. Well, I look at that and say, get thee hence. I'm not doing that. For me and mine.
I'm perfectly comfortable discussing religion and sociology and psychology. I also read deeply in those fields as well. My undergraduate minor was in abnormal psychology. I think if you study the human creature enough, it is self-evident that humans look for meaning. Yeah. And we are tribal animals by literal definition. There is no way to get around that. We look for a belief to latch on to and to use to create part of our identity. Our identity is in part comes from our clan, our tribe. In part, it comes from what we believe and what we eschew. No, that is false. I don't believe that. And even people who believe in nothing, if you're a complete agnostic or atheist, if you've studied the human creature enough, you know that we are highly susceptible to latching on to a belief. For many of us, it's a very popular belief, or it's a belief that is propounded by somebody who we look up to, a celebrity, an athlete, or somebody, and we'll just irrationally adopt that belief. And if that's part of who I am as a human being. Humans are very susceptible to that, and scientists, you would hope, would be aware of that weakness in human beings. And so even if you don't believe in a God, you still have beliefs in something. Yep. But it seems like scientists are actually, in many cases, using. Oh yeah. Some would call that a weakness in human nature, or some would call it a strength. Let's just call it an attribute of human nature, that we love to believe in stuff. We love stories. We love mythology. Yep. Whether it's ancient or modern, it doesn't matter. But we are highly susceptible to latch on to something like that with no evidence whatsoever. And it seems like many of the plant-based PhDs, MDs, and world authorities on health and nutrition are absolutely latching on to that attribute of human nature, that people will believe irrational things if it's said by the right person.
Yeah. So indeed, with regards to kind of plant-based view, the most common refrain is that saturated fat causes insulin resistance and thus causes type 2 diabetes. To just sort of finish that final question, because I have very, very strong thoughts on that. And if I may say so, I can speak with some authority because I've published multiple reports on that. Much of my fellowship experience and the manuscripts that came from it was based on exploring the differential effects of fatty acids and causing insulin resistance. So this is what they get right. And then I'll say what they get wrong, because what they get wrong outweighs what they get right. What is correct is that when you take a cell culture, so I'm growing muscle cells or fat cells in a little petri dish.
Yes.
And if you incubate those cells with palmitate, the most common saturated fat in the bloodstream, they will become insulin resistant.
Absolutely.
And that's what they get. That's what they get right. That is true. But where they get it all wrong is once you go one step deeper up or one step further up, when you say, okay, what about the whole body? Is treating cells analogous to eating saturated fat that may come from red meat? It is not. Jeff Volek has shown very, very conclusively that if carbohydrate consumption is going down, even if you double or triple the amount of saturated fat a person is eating, the amount of saturated fat in the person's blood is significantly reduced. Yep. And then as you titrate the carbs up, even if saturated fat is down, now all of a sudden saturated fat in the bloodstream starts to go up. So the great myth is them assuming that these studies, some of which are my own publications, I published those reports, and I had to go through my own evolution and awareness to realize, wait a minute, Ben, you're enough of a physiologist. Yeah, I'm a cell biologist, but I'm enough of a whole body guy to realize that treating cells with palmitic acid is not the same as eating a steak. Absolutely. And indeed, the evidence doesn't back it up. These studies have been very well done. If you have someone who's eating multiples more saturated fat in the context of a low-carb diet, their insulin resistance gets significantly better. So too do markers of inflammation and, of course, numerous other clinical outcomes. So at the base level, with randomized clinical trials, they are wrong. They are, if I can be silly, they're preaching this false gospel, this message, the mission that they're on, even if it's with the best of intentions. Yeah. And I don't know that it always is, to be perfectly frank.
Agreed.
I can speak as a person who has published and conducted these experiments. What you see in a cell culture does not translate to the whole body in the consumption of fats.
Absolutely. I got to